You're listening to the Residential Movement, where the focus is on making in-home dental care normal instead of novel or niche. I'm your host, Dr. Ashley Robinson, a house call dentist with a lot of passion for reaching patients who are best served in their home or residence. I'm here to encourage, equip, and empower dentists like you to begin offering in-home dental services for patients who cannot get to the office, while also enjoying a more balanced work life. We discuss everything from dentistry, business, ethics, mindset, and more. Listen in to learn how you can become a part of the residential movement. Hey there! This week's episode is a response to a listener's question. I just have to tell you, I love when you reach out with questions. In case you didn't know, you can always reach me at hello@residentialmovement.com or DM the Residential Movement on Instagram with questions. The listener question I'm excited to discuss with you is, does every patient need comp care? Now, after checking in more with the listener, we decided that the more specific question he meant to ask was, do you only offer comp care in your dental house call practice? So I'm going to answer both the original question and the question that he actually meant to ask today. Now, this listener was a chairside dentist who is strongly considering offering dental house calls, and I think a lot of you might be at that same step in your house call journey too, so I hope you can benefit from this answer. Now, we all know that our dental training is based on a comp care model. It's useful to look at the patient's entire mouth before developing a treatment plan. You can't make an RPD to replace missing teeth without evaluating the health and periodontal condition of the abutments, right? So yes, if you're going to offer in-home dental care, you should strive to offer comp care. It's absolutely what's best for most patients. AccommoDental, my in-home dental practice, primarily offers comp care. When we get new patient inquiries, we explain that our first visit is a comp oral, where we develop a treatment plan and then move forward with treatment at subsequent visits, just like a chairside dentist might do. Then I see these patients every 3 to 6 months for recare, just like a chairside doc. I have long-term relationships with my patients and their family. This is how most practices work and how I think your home care practice should work. Every patient, even those who are best served at home, should receive dental care regularly. Still, AccommoDental also gets inquiries from patients who have a singular chief complaint that they want me to address. Oftentimes, it's a loose crown, sharp edge, broken tooth, an abscess, or other things like that. Do these patients need comp care? Well, yes, but that is not their priority right now. My patients and their caregivers have so many health concerns or other overwhelming concerns, and they might just not be up for routine dental care. So I'll still see them for limited exams and execute limited treatment plans just to make them comfortable. Unpopular opinion alert. Limited exams and limited treatment, even for patients who are able to get to the dentist, are incredibly valuable and not offered nearly enough. So many offices refuse to see patients unless they want to pursue comp care. It's unfortunate that patients in acute pain, especially patients who don't have a comprehensive dentist, can't usually find an available dentist to address their needs. This is because dentists tend to build their schedule and practice based on the comp care model. When I address only the chief complaint of my patients in their home, I do not mislead them. I tell them that they definitely need a comp exam and need to get on a routine dental maintenance schedule. Their limited interaction with me might even convince them to pursue comp care with me. But sometimes they still decide to decline comp care. Maybe they'll change their mind and pursue it someday, or maybe they won't, but at least we helped them today. Unfortunately, there are always going to be some people who do not value comprehensive dental care. They will never seek it, and they'll only look for a dentist when they're in pain. Yes, we can inform and educate and do our best, but some people just will not pursue comp care, and we need to accept that. People have very complicated lives, especially people who cannot leave their homes. These patients with acute problems should have access to a dentist, even if they aren't going to pursue comp care. We'd never deny access to emergency physicians for a person who never visited their primary care provider, so why do so many dentists insist on only offering comp care? Offering limited exams and limited treatment plans decreases the line of dental patients in the ER, where they won't get any treatment anyway. So I do recommend offering urgent care for new patients, whether you offer house calls or are a chairside dentist. So far, we've talked about patients who need comp care and pursue it, and patients who need comp care and don't pursue it. But still, there are patients, in my opinion, who don't need comp care at all. Now, these patients are the ones who are nearing the end of their lives. As a house call dentist, one of my biggest referral sources is hospice. We might hear from patients directly or from their family. One of my patient's daughters called me because her father had a sharp tooth that was cutting his tongue. So I went to his house and his exam revealed a non-restorable dentition. Did he need to begin a comp treatment plan of full mouth exos and implant overdentures at that moment? Would that really have been the most ethical treatment plan for him? No. The goal for him was to spend his remaining time with loved ones comfortably. I smoothed the broken tooth and let him be comfortable. So here's the truth. The truth is that most patients absolutely need comp care, whether they're patients who need in-office treatment or in-home treatment. That doesn't mean they'll all pursue it, though. And for those who don't, I still offer limited treatment plans. Finally, I really believe that some patients do not need to be pestered with comp care. SRP isn't the thing someone needs at the end of their life, you know? We have to develop ethical treatment plans that consider the unique circumstances of individuals. This means that the treatment plan could deviate from the ideal plan you were taught in school. These are my opinions about comp care, limited care, and end-of-life care. So thanks for hearing me out, but it's up to you to make ethical decisions and offer services that you think are best for your patients. Just as some people need comp care, even if they don't pursue it, there are many patients who need in-home dental care who don't pursue it due to cost. If you're interested in supporting patients who struggle to afford in-home care, consider contributing to the Home Smile Care Foundation. This is a nonprofit organization founded by myself and my loved ones. Visit homesmilecarefoundation.org for more information. Thank you for the thoughtful questions, and thank you for listening today. I really appreciate you. That's a wrap on this episode of the Residential Movement. If you like what you heard today, please leave a 5-star review and subscribe so you don't miss an episode. If you know someone who could benefit from this information, please share this with them. All of these actions help fuel the residential movement. Visit residentialmovement.com for show notes and for access to any links referenced in this episode. Thanks again for listening, Doc. Keep up the good work.